Hello, everyone. See some attendees still trickling in, so maybe give us one more minute before we get started here. So I'm going to see if that participant count gets a little closer to 40, and then we can get started here. Awesome. Well, we're 2 minutes over here. Thank you all so much for making the time to join and sit in on this virtual event with us. My name's Joey. I am part of the NeuroMedical team. We are a national neurology platform that partners with clinics all across the country, across subspecialties, but certainly with a focus on multiple sclerosis and partner with the clinics whose logos you see on this page here. We've got Rocky Mountain MS Clinic out in Utah, and one representative here on the panel today, Kara Menning, is an MS certified nurse who works at the clinic with 20 plus years of experience there. We've got MS and Neuromuscular Center of Excellence down in the Tampa Bay area in Florida, Advanced Neurology of Colorado out in Fort Collins, and Central Texas Neurology Consultants out near Austin, Texas. So thank you again. I'm sure a number of the attendees here are currently receiving care at one of these clinics. And really a pleasure for us to be able to partner with these clinics to set up patient-facing events like this. It's our goal to try to create more community amongst our patient base. So really excited to have this kick off what we hope is a continuous series that we'd like to brand as our NeuroWellness talks and make this a more regular patient education event series that we are able to carry on moving forward. One kind of quick, just to level set on expectations for this time here, we'll start off by having Kara introduce herself and background and passion for this topic. Then Melanie Romer will go through a presentation that she's put together here on all things nutrition and wellness. And then we'll save about 15 minutes at the end for Q&A. So as you have questions throughout the presentation, please feel free to drop them in the Q&A feature here in the webinar, and we'll make sure to get all of your questions answered in about those last 15 minutes where I'll play moderator for both Kara and Melanie. But without further ado, I'll pass the baton here to Kara.
Thanks, Joey. Good afternoon, everybody. My name is Kara Menning, and I'm a nurse practitioner at Rocky Mountain MS Clinic in Salt Lake City, Utah. As Joey said, I've been caring for patients with MS for about 25 years now. And over that time, I've really had the privilege of, walking with patients and their family members through all different stages of the disease and, navigated the treatment landscape changing so much over those years. And while I'm trained in medication management, disease management, one thing that I've really learned a lot more about, and seen so much of and been more convicted of is living well with MS goes really, beyond just prescriptions or things like that we can often focus on in clinic visits. And people that really do the best are those that focus on that whole person wellness, whole person approach to their health. So addressing not just MS directly itself, but also different lifestyle factors that can affect energy and brain reserve, resilience in general, and just long-term wellness. So we know MS is a chronic condition. Inflammation plays a role. And inflammation is something that patient to patient is common, but otherwise, as you all know, MS is very individual, person to person. There's not a one size fits all kind of answer. Um, but we do know another thing that we can kind of generalize is that lifestyle medicine, as we call it, so things like good nutrition, exercise, stress management, restorative sleep, uh, these things can make a meaningful difference for everybody. And there's a growing amount of evidence for positive long-term outcomes in people living with MS. So it's pretty exciting that I think the community in general is ready to focus more on these types of things too. One of the questions I hear the most often is what's the best diet for MS? And the truth is there's really not one magic diet. Melanie will talk a lot more about all of this, of course, but research has shown some common threads, and one commonality is eating more towards anti-inflammatory foods. Again, Melanie will focus somewhat on that as well in her presentation. So while my role has been for a lot of these years focused on the medical management of MS, I've really become just more and more passionate about the lifestyle management as something that really can empower patients, which I love because I think MS can feel like such a disease that's out of a person's control. But there are a lot of different factors that you do have control of. And while medications are critical, those disease modifying therapies, I will always say those are a big important part of somebody's treatment. All these other factors like what you eat and how you move your body and how you rest, if we think of those as kind of setting the foundation, and then these disease modifying therapies and other medications kind of working on top of that, that's sort of the way I've started to conceptualize some of this stuff. So I'm just really excited to be here and participate. I know that we're going to all learn a lot from Melanie. And I think together we just really hope that you'll leave here with some really practical knowledge and tools and encouragement, that this is something you can carry forward in your life as you're managing MS with your healthcare team. I wanted to give one plug. If you do want more information, I know as a clinician, I always love it if people schedule appointments specifically to talk about this kind of thing in clinic. So I would encourage you, I know we're kind of coming from all over the country, whoever you're seeing for your MS management, don't hesitate to schedule appointments to talk specifically about this kind of stuff and make sure you've got some time for that. So without further ado, I will hand it over to Melanie.
Awesome. Thank you so much, Kara. Hello, everyone. I'm so excited to be here and to present to you today. So yeah, let's just get right into it. We're going to focus on eating well with MS and autoimmune conditions as a whole. A little bit of an intro. Oh, we've got a funny little transition, a little intro about myself before I dive in. So I'm a registered dietitian. I have been for over 7 years, and my real focus is to help people feel their best through food and lifestyle. My background includes working with over 500 clients now at this point in my career and counting. I am the founder of my private practice, Earth to Mel, and I really focus on root cause functional nutrition. I'm also a certified yoga instructor. And then within my practice, my main focuses are holistic gut health, mental health, and autoimmune care. And then a little personal tidbit about myself is I also have an autoimmune condition. I was diagnosed with celiac disease back in 2012. So this is both a professional and a personal passion of mine. And what we will be getting into today, we're going to focus on why nutrition matters, MS diets and diet foundations, anti-inflammatory eating, as Kara mentioned, some key nutrients, protein and blood sugar management, practical tips of how you can make all of this work in your life, regardless of energy and function. And then a very hot topic right now are GLP-1 medications. So I will touch upon those as well. And then we will get wrapped up for the Q&A after that. So first off, why does nutrition matter? So nutrients are behind everything that our body does, but more specifically in the role of MS and autoimmune, they help to reduce inflammation. And I guess this can kind of go both ways, because depending on what kind of diet you have, that can also promote inflammation in the body. So really prioritizing anti-inflammatory foods can help calm down the system and reduce inflammation. Nutrition can also help us prevent deficiencies. So like I said, nutrients are behind every process in the body. Having the proper balance helps to equip your body to be able to do its job and for you to feel good and have energy and fuel every process in your body on a day-to-day basis. Nutrition is important to your gut microbiome as well. So what you eat helps to influence which bacterial species reside within your gut. And your gut is your body's largest immune organ. So having good gut health kind of translates to having good immune health to some degree. Diet is also important to combating cellular damage. So antioxidants are needed to help balance out oxidative stress, which if left unchecked can go on to damage cells. Immune support is also a large role that diet can play. Nutrients help to influence how our immune cells behave, and they can help minimize these cells from overreacting in the body. And then kind of as a lump sum of all of these things, when nutrients are there to support these processes, really can dictate your quality of life. They can help improve your energy levels, help to minimize symptoms, and overall just make you feel better from a day-to-day basis. So if that's not a motivation to, to hopefully be able to implement some of what we're going to talk about, hopefully the rest of the content will be. So there's a lot of talk about a lot of my clients ask me what the best diet to be on is with MS and then with autoimmune conditions as a whole. So we'll go over the more popularized diets. The first one that really I think was more prominent was the Swank diet. And this was developed in the 1940s. It focused on low fat, reducing dairy, emphasizing fruits and vegetables and whole grains while limiting red meat. And then the Walls Protocol came on the market around 2014 by Terry Walls. And she found that prioritizing a high vegetable intake, quality protein, and healthy fats, as well as going gluten-free, dairy-free, and egg-free, helped for her to minimize her symptoms and improve her quality of life. And then she went on to study this and came out with this protocol. There is also a lot of talk in the autoimmune world of going gluten-free and dairy-free. And then I'm going to jump down to the autoimmune protocol, which actually is both gluten-free and dairy-free, but it's a little bit more strict of an elimination diet. It takes out grains, legumes, nightshades, and processed foods as well, while prioritizing nutrient-dense whole foods. And then less of a specific to MS and autoimmune diet, but a largely popular diet is the Mediterranean diet. And this focuses on high fruit and vegetable density, whole grains, legumes, nuts, olive oil, fish, and then limiting red meat and processed foods. So as you can see, there's a lot of different diets that sometimes say that they are the best diet for MS and for autoimmunity. So let's get to the bottom of which one of these, if any, is the best. And I will say that if you kind of overlap all of these diets, they don't all share the same characteristics, right? They vary from diet to diet, but the kind of common denominator across all of those is prioritizing whole foods over processed foods, and then prioritizing a high fruit and vegetable density in the diet. So while there really isn't a one size fits all, these are two things that we know are healthy for all diets and then are additionally supportive for autoimmune and MS. So that would be one of the foundational things to focus on in your diet, is trying to shift away as best you can from processed foods and ultra processed foods to a more whole food based diet, as well as working to increase your fruit and vegetable intake. So some applicable ways that you can do this include shopping the perimeter of the grocery store. It's often, and this isn't always the case, but oftentimes in the inside aisles of the grocery store, that's where we're more likely to have access to those ultra processed and processed foods. We're generally speaking, it's the produce and the dairy and the fresh meat and seafood that you find on the perimeter. So that can be a helpful rule of thumb to follow, but might not apply depending on the organization of your personal grocery store that you shop at. Another good tip to strive for is to try to cook at home whenever you are able, as opposed to dining out and eating at fast food restaurants. And then another helpful little thing that you can keep in the top of your mind to help prioritize the fruits and vegetables are eating the rainbow. So every different color that you see from a fruit or vegetable has its own unique antioxidants and phytonutrients in it. And by getting the most variety is going to help equip your body with all that it needs. So striving to eat as many different colors throughout the day or throughout the course of a week can be a really helpful guide to make sure that you're prioritizing variety in what you're consuming. And then shifting a little bit away from that high fruit and vegetable and whole foods over processed foods, key points is making sure that you're staying adequately hydrated by drinking plenty of water throughout the day. And then another thing that I really like to instill in my clients, especially with processed foods, ultra processed foods, and kind of what we have available to us on the market in America in 2025, there's an abundance of sweet options. We can drink sweet, we can eat sweet all day long, and pretty much, especially here locally, if I don't know how many of you are in the Utah area, but there's quite a few soda shops on every corner. And so it's really not hard to come by. But when we consume sweet all day long, our taste buds kind of become acute to it and like to prioritize that over other tastes. So I really like to encourage trying to consume a variety of the other tastes, which include sour, bitter, salty, and umami or savory. Umami, if you haven't heard of it, is kind of that taste that you find in meat. Soy sauce is a very umami rich flavor, as are mushrooms. And so throughout what you're consuming, trying to make sure there's little bits and pieces of those other taste profiles can be really supportive in bringing forth variety in your diet. And then bitters specifically actually help to support digestive enzymes and stomach acid, which can improve digestion. So this can be a really helpful thing if you feel like you don't tolerate food well, to try to get a little bit more bitter flavor into the diet. And bitter flavors, for example, grapefruit is a great option. Bitter greens, things like arugula is another great choice. Even coffee, when it's unsweetened, would be a bitter flavor as well. And then moving on to that other big common denominator that Kara referred to, which is anti-inflammatory eating. So I touched upon this a little bit already, but to go into a little bit more depth with what does this exactly mean? Because it's a term that's thrown around quite a bit. So there are foods that we can consume that directly combat or reduce inflammation. Yet again, we have colorful fruits and vegetables popping up as a great source of anti-inflammatory foods. And then another big category is omega-3 foods. So these include salmon and other fatty seafood, flax seeds, nuts and seeds in general. Walnuts specifically are a phenomenal source of omega-3s. And then other foods like our spices like turmeric and ginger also have anti-inflammatory components to them, as does green tea. The cooking fats that you use can influence how much omega-3s you're consuming. So extra virgin olive oil, grass-fed butter and ghee, coconut oil, and avocado oil are all richer in omega-3 fatty acids than other cooking alternatives. And then I did specify the grass-fed butter and ghee, and that is because when it's within budget, grass-fed options are typically higher in omega-3 content than their conventional counterparts. So if that is within your price point, to choose a grass-fed option over the conventional alternative, that is a great way to improve your omega-3 uptake as well. On the flip side, foods that directly contribute to inflammation, as I've mentioned before, ultra processed foods, sugary drinks, fried foods, and refined oils. I do want to touch upon the canola oil image too, and I did try to find one that was maybe less labeled. I know canola oil is getting a lot of heat right now, depending on what kind of health information you're taking in. And I do just want to speak to that a little bit. So where the oils that I mentioned, the extra virgin olive oil, the grass-fed butter, ghee, coconut oil, and avocado oil are all rich in omega-3 fatty acids, which help to reduce inflammation. More processed and refined oils, such as canola oil, have a richer omega-6 content. And so specifically with canola oil, it has a 2-to-1 ratio where it's got more omega-6 fatty acids in it than it does omega-3 fatty acids. And the omega-6s are more pro-inflammatory. And so because we have a lot of foods that are more pro-inflammatory in the diet already, we don't necessarily need those extra omega-6s from canola oil. And that's where we could really benefit if it's something that we're using more often by selecting something like one of the other healthy cooking fats that I mentioned. And then getting into some of the key nutrients. So vitamin D is, I think, one of the most commonly spoken about nutrients regarding MS. And the reason behind this is there are a lot of studies that have been linked to show that low vitamin D status correlates with increased risk and severity of MS. But I do want to point out that more isn't always better. And this is true of all nutrients. So we definitely don't want to, just because the research is there, go off and supplement with vitamin D. It is very important that we make sure we're doing so safely, and that if you were to consider supplements of any sort, that you're working with your practitioner and making sure that you're testing for those levels before just guessing and supplementing. So we do also always want to try to prioritize these nutrients through food first as well. With vitamin D, one of the best places that we can get it is through sun exposure. But through diet, it is also found in things like mushroom and seafood. Cod liver oil is a great source of vitamin D as well. But it is found more sparingly in the diet. And when sun exposure is an option, that's going to be the best way to promote vitamin D within the body. Omega-3s, as I've already touched upon, are another key nutrient. And to get a little bit more specific to MS, omega-3s are an essential component of the myelin sheath, which is what helps conduct nerve signaling. So they're important specifically for nerve signaling in the body. And then, as I mentioned before, they're great at reducing inflammation. Protein is what I would categorize as another key nutrient. And the reason why is because protein is really the building block of our body. So it helps to maintain your muscle strength. It helps to prevent muscle wasting, and then supports overall mobility and function. And we'll talk a little bit more about protein later on. The next key nutrient that is important is magnesium. And this is gaining a lot of popularity right now as well. Magnesium is important for so many different processes in the body, including nerve signaling, muscle relaxation, energy production. And through all of this, getting more magnesium in the diet can help ease symptoms like muscle spasms and fatigue. So magnesium is found in pumpkin seeds, are a great source of it. And then it is also I found a little bit more sparingly in the diet as well. And I do want to touch upon how I didn't list specific foods for each of these nutrients, simply because I wanted to talk more about the how, or like the what these nutrients are doing for you. And for all of these nutrients, a quick Google search helps to populate different foods that you can focus on consuming more of to get more of these nutrients in the diet. Another key nutrient is the B vitamins. And so this encompasses quite a few vitamins, and they all have different unique purposes in the body. They are also found in different food groups as well, depending on which B vitamin you're looking at. But generally speaking, they're great for supporting nerve function, energy metabolism, as well as the maintenance of the myelin sheath, which protects the nerve cells, as I mentioned in the case of omega-3s. Eggs are an awesome source of quite a few of the B vitamins. Specifically, the yolk is super rich in choline, which is an excellent B vitamin for neurocognition. They're found largely in animal sources, and then as well in nuts and seeds and some plant-based sources as well, kind of depending on which B vitamin in which food. And then lastly, the other key nutrient that I've identified for today, they're all kind of all of our nutrients are important to some degree, right? But these are some standout ones. Antioxidants is the last that I included. And as I mentioned earlier, how diet is so important to combating cellular damage. This is where antioxidants really play a role. They help to neutralize free radicals in the body, which helps to reduce that oxidative stress and therefore protect nerve cells from damage. I look at oxidative stress as kind of like unnecessary wear and tear on the body, and antioxidants are the things that help to prevent that wear and tear from happening. All right, so as I alluded to, protein. So it's important as a building block of the body, helping promote muscle strength and mobility and preventing muscle wasting. But from more of a blood sugar perspective, protein really supports satiety or fullness in the body compared to fat and carbohydrates. So this can help us feel full longer after a meal, meaning that we're not back in the fridge feeling peckish, a half hour to 45 minutes after we've eaten something. It also helps to support blood sugar by slowing down how quickly carbohydrates are digested and absorbed through the bloodstream. And so because of this, because it's so great at helping go the distance between our two meals or our snacks throughout the day, I really encourage my clients to try to incorporate a healthy dose of protein at both meals and snacks. And so usually what this looks like is people are great at making sure there's a good protein source at lunch or dinner, but oftentimes we might find ourselves having just a bowl of cereal or a bagel for breakfast, or snacking on just a banana or a bowl of fruit for a snack. And that's where I think there can be a lot of room for improvement with protein content by making sure there's some like an egg or some smoked salmon with the bagel, or a little bit of plain Greek yogurt or peanut butter alongside that banana as a snack. And when my clients are able to implement this, they notice a huge difference in that blood sugar stabilization throughout the day, feeling like they have more energy. They're not thinking about food. That food noise kind of starts to subside a little bit. And so some good examples of protein, if you're unfamiliar with where to find that in your diet, include, but are not limited to, eggs, Greek yogurt, beans, chicken, fish, nut seeds, meat, cottage cheese, and of course many other options. But those are some of the more grab and go options, which I think can be great for protein, is having easy sources of it on hand in your cabinet. And then putting this all together and kind of making it practical for you in your day-to-day life. So we talk about going whole foods and shifting away from processed foods. Now, I think when people start to think of that, they think that they shouldn't have frozen vegetables or the pre-chopped produce in the grocery store, and that suddenly everything has to be done from scratch. And I think there's a lot of middle ground here, right? So if you going and getting frozen bell peppers and onion blends and keeping those in your freezer so that you have quick and easy meals helps make this more realistic for you, that is a much less processed food than something like like a bag of potato chips or something. So while it is considered processed on some level, it's very minimally processed. And that can be a great tool to lean into to help make life easier and to help make things more realistic for you to cook more meals at home instead of eating fast food or skipping meals altogether. So I definitely like to encourage using those when they're within budget and when you have access to them. Even making sure that you keep a couple of different frozen vegetable varieties in the freezer for quick weeknight meals can be very convenient. The other thing that falls in the same category is those minimally processed meats. So pre-cooked proteins, even a rotisserie chicken can generate quite a few meals coupled with a bag of frozen vegetables, and you can have that on the plate for dinner or for lunch in a matter of minutes. So those can be great resources when yeah, when energy might be too low to, to cook your own full chicken at home. Another great way to help streamline things in the kitchen can be to batch cook things. So that can include grains, beans, taking a whole dozen of eggs and hard boiling them all at once, and then maybe writing with a Sharpie on the carton that they're hard boiled so no one tries to crack them into their omelet in the morning. But those can be great ways to help kind of simplify things and take the amount of work that you're putting into cooking and get a higher yield from it. With grains, things like rice, and then not a grain, but a starch, potatoes, when we batch cook those and heat them up leftover using proper food safety, that cooking and cooling process actually helps to generate something called resistant starch. And resistant starch is a prebiotic that helps to feed the good microbes in your colon. So this is an example of where batch cooking can actually help you get more out of your food as well. And then keeping things simple, buildable is kind of like having certain ingredients on the house that you can just quickly assemble. So maybe having like pre-cut vegetables, a protein ready to go, a couple of different grains to choose from, and then selecting a few of both of those things. So it's more of an assembly that you can do throughout the week rather than having to cook every single meal that you're preparing from scratch. And this is kind of the concept of ingredient prep, where you have things that are that can work well with a number of different meals, as opposed to meal prepping, which is where it's more similar to the image that I've included here, where you're kind of prepping the same exact meal for the week and you're portioning that out. This meal prep can absolutely work well for a number of people. I do know for a lot of my clients that they start to fatigue with eating the same thing 4 days, 5 days in a row. And it can oftentimes feel like a lot of work up front. So that's where ingredient prep can be one of those like happy medium middle grounds of, it's not necessarily taking all day Sunday to get everything prepared for the week, but you're getting a few things cooked and ready to go in large enough quantities that you can then just assemble them later throughout the week to make yourself nourishing meals. And so all in all, what I want to encourage most is thinking about finding the middle ground rather than all or nothing thinking. I know it's easy to feel like if we're not doing everything perfectly, that it's almost not worthwhile to do it at all, but making these small tweaks and getting yourself just closer to that less processed anti-inflammatory diet is really going to do your health a wealth of good. So any small tweak that you can make is not too small. And then lastly, getting into the GLP-1 medications. So if you are unfamiliar with what these are, GLP-1 stands for glucagon-like peptide 1 receptor agonist. So it's a drug class that basically mimics and helps to increase a natural hormone that your body has. And that hormone is the GLP-1, and it helps to regulate blood sugar and appetite. So the common brand names of these medications for semaglutide are Ozempic and Wegovy. And then the other kind of main competitor is tirzepatide, and that's branded as Mounjaro for diabetes, and then Zepbound for weight loss. So the potential benefits that these medications offer are improved blood sugar control, weight reduction, possible heart health benefits, and they work by decreasing gastric emptying or slowing down how fast things are moving through your stomach, which serves to increase fullness and satiety. And then the medications can also help to enhance insulin release after meals and reduce glucagon, which lowers your blood sugar, and then suppress your appetite, which can in turn support weight loss. Considerations: a lot of people do experience nausea, vomiting, diarrhea less frequently, a lot of constipation just because of that slowing down of the entire digestive tract. They are prescription only, so it is important for you to work with your provider and make sure that this is a good fit for you if this is something that you're interested in. And this is the thing that I really want to emphasize the most with these medications, because I think they're getting a lot of noise around them, and there's a lot of appeal and allure to them for how much weight people are able to lose. I do work very closely with a lot of clients who are on these medications, and what I do know to be true is that they work best alongside healthy lifestyle habits and improving diet. And so a lot of times by improving diet and improving lifestyle habits such as movement first, without necessarily starting these medications, people can experience a lot of improvement without the medication and without being at risk of those possible side effects. So I do really want to encourage, if this is something that you're interested in, but you are waiting on the medication or you have yet to make diet or lifestyle changes first, that it might be a great thing to try making some of the tweaks that we talked about today with diet, and working with a practitioner to help improve exercise to see where that gets you first, and then work with your provider to see if this is a good fit for you. The other point that I wanted to just state too is that while the GLP-1 medications help to increase your natural hormone, eating healthier, eating a higher fiber diet, a higher protein diet, managing stress levels and improving sleep and exercise are all also things that help to naturally promote that same production of the GLP-1 too, regardless if you're on the medication or not. And that is all I have for you. My last slide is just going over some of the key takeaways that I really wanted to emphasize. So the common denominator that we identified with diet is trying to have a whole foods diet that's rich in color, lots of fruits and vegetables. This will help to support your immune system and your energy levels, making sure that plenty of protein is showing up with your snacks and your meals to support your blood sugar, your metabolism, and then your muscular health. And then focusing on simple, realistic swaps for daily life, and always keeping in context that it's more about progress rather than perfection. So thank you so much. It was an honor to be able to speak to you all today. I do run a private practice, as I've mentioned. So if you're interested in working together, or if you have any questions, please feel free to reach out. I'm available via social media. You can call me, you can send me an email. And I do have a monthly newsletter that I send out once a month. So if you're interested in subscribing to that, you can do so on my website, earthtomel.com. And then lastly, Kara wanted to highlight an upcoming program being put forth by the Brain Health Program. So that information is displayed here. You can sign up on the brainhealthcr.org website if you're interested in it. It is a 3 free week program that focuses on a personalized program to help improve brain health and MS. And that is occurring Tuesdays and Thursdays from 5 to 6 p.m. Mountain Time. Thank you so much.
Awesome. Thank you, Melanie, and Kara both. As promised, have reserved the last 20 minutes or so here to go through some Q&A. Looks like we've got one question from James just to get us started. Maybe Melanie, for you to start, and Kara, feel free to jump in here. But a question just around vitamins and supplements. Do you see those really making a difference for folks with MS and other autoimmune conditions?
Yes. So I want to emphasize that it's important to keep in the context of where someone is coming from. And so I think a lot of times we see protocols for supplements of, oh, you should just take, X, Y, and Z if you have this condition, where really it needs to be a more nuanced approach, working with your provider to get blood work done and make sure that there is a necessity to be supplementing. And then when that is the case, absolutely, these can make a huge support and help kind of maybe make up the gap sometimes between, well, it's important to prioritize getting all of your nutrients in through food, depending on how far of a deficiency and how long this deficiency has been going on for. Food can take a little bit longer to help correct things. So supplements can very, very much be a helping hand to kind of fill that gap.
Yeah, I totally agree. I think vitamin D is probably the biggest one in MS that we have, some evidence about it, but absolutely agree with what Melanie said. That's something that we can check levels with a blood test and then supplement accordingly. And it is one that you don't want to get to like a toxic level of. You can have some problems then with too much calcium in your blood and kidney stones, and a bunch of other things. So again, to the point of more is not always better. So checking labs is good. Another one that comes to mind is B12, can be checked in blood work. And the connection there with MS, I don't know that there's too much, but low B12 can mimic some MS symptoms. So you can have like numbness and tingling, brain fog, fatigue. So kind of in a comprehensive, look at symptom management. A lot of times we'll think about these deficiencies as something we don't want to ignore and just blame on MS.
Got it. And it looks like one just follow-up question from James here. Are there any different types of supplements? I think you spoke to this a little bit, but have heard magnesium referenced as potentially helpful. Are there different types that folks should be aware of that are, more or less impactful based on the research available?
I'm actually curious, Melanie, what you would say about this too, because I sometimes wonder, the magglycinate or mag citrate, kind of the differences between them. I know sometimes we'll advise patients to take this, and it can be helpful for things like muscle spasm, um, sleep, constipation. So I would love to hear what Melanie has to say from her perspective.
Yeah. So different forms kind of have different functions in the body. For example, magnesium citrate is more of like a laxative form of magnesium. So this can be very great for helping alleviate constipation. But if you are someone who has more of a tendency towards looser stools, the magnesium citrate might not be the best form for you. There's also varying levels of bioavailability, which just means different forms of magnesium might be better or worse digested and absorbed in your system. And so I personally like to, a lot of times I find kind of like the jack of all trades for magnesiums to be magnesium glycinate. It's not super strong in just one area, but it helps in a gentle way kind of improve sleep and help support muscle. And so I feel like that's kind of like the jack of all trades, for less of a better phrase there. But sometimes that's not aggressive enough when I'm working with more of a constipation prone client. Again, there's nuance there. And I think working with your practitioner can help you identify what the best form for yourself and for what your needs may be.
Thank you. We've got one question from Mike here. Sounds like there's been some research tying salt intake to relapse prevalence. And he's got a question around, is there a specific type of salt he should use to cook with? I don't know if either of you have a perspective here.
I'm aware of some data. I feel like the original data came from Argentina. Don't quote me on that though. But yeah, I've seen some data for that. And I think there are people in the community that kind of, in addition to the Mediterranean diet, recommend the DASH diet, which I'm speaking, I shouldn't be speaking on this because we have the expert Melanie here, but low sodium has shown there's some positive data for MS. As far as what type, I don't know. Melanie, do you have any input on that?
Yeah, so I'll speak a little bit to as I had emphasized, going a whole food and less processed, that inherently is going to create such a decrease in sodium consumption because in ultra processed and processed foods, salt is used as a preservative. So when you're not having those preserved or processed foods, sodium naturally decreases. To the point where usually we're within a healthy level where we can still salt our food to make it taste good and not be doing too much harm. I don't know specific like recommendations for in MS, like what salt levels are recommended. But in terms of salt quality, I think that here in Utah, we have a wonderful salt option. It comes from Redmond Real Farm. And that's great because it comes from an ancient seabed. So there's a lot of trace minerals that come with the salt, things like boron and manganese, that aren't found in more processed salts. So that can be a great way to help improve your nutrient intake. And then another alternative that's similar in having those additional trace minerals, and is less processed, is Celtic or Celtic sea salt as well.
I think, Melanie, is this just a general recommendation, or did I see this about MS, 1 teaspoon or less a day of salt?
I think I
Which
saw that.
seems like a very little amount, kind of, but is
Yeah.
that accurate?
Yeah. I want to be really careful in what I'm saying with sodium related to MS, because I feel like I've seen some conflicting research of like some of the studies have been disproven, or yeah, so I don't want to give like a blanket recommendation there. I
Sure.
think in some ways we don't necessarily know fully. And then I think it's also important when we're thinking about nutrients and how they operate in the context of other nutrients. So for example, sodium and potassium are like, so important to one another in the diet. So that could also influence what someone's tolerance for something like salt is. If there is more potassium in the body and in the system to help balance that, that might allow for a little bit more liberal of a salt take, where if potassium status is really poor, that could further restrict sodium intake as well then consequently. So that's what I do know, and I don't want to like say any further recommendations than that.
Yeah, makes sense. Yes, that's great. Thank you.
Thanks. One question from Tabitha here. For those who can't tolerate omega-3 fatty acids, what would be a good replacement?
Interesting. My mind is wondering what would be interfering with that with tolerability of those foods. I would say from an anti-inflammatory perspective, focusing on the other anti-inflammatory rich foods. So thinking about antioxidants, high fruit and vegetable intake, things like ginger and turmeric and green tea, if those are tolerated well, and then prioritizing like every other nutrient, making sure that you're getting in plenty of protein, and that sort of thing. Um, yeah, and that would be my. I have a lot more questions coming up with that question, but that would be my answer for now.
Sure. Sorry, a quick follow-up on the salt conversation earlier. Any perspective specifically on pink Himalayan sea salt, Melanie?
I don't know off the top of my head the specific nutrient profile of pink Himalayan salt. I do know, and this kind of opens a can of worms with the world that we're living in. I do know that with certain sea salts, they have tested higher for microplastics, unfortunately, with how much plastic is being polluted into the ocean. So that's one just to be a little bit more mindful of when you're doing a sea salt based salt, is just awareness around that. But I don't know about the nutrient profile of pink Himalayan sea salt off the top of my head.
Uh, Tara, I think this is a question for you, but from Bruce, are there specific blood panels that might show whether nutrition and diet changes actually, show improvement? Maybe
Mm.
body responses or symptoms for MS? Are there things we can point to show that that
Yeah,
actually has
sort
a
of
direct impact?
prove that we're doing
Yeah.
something. Yeah. I mean, kind of going back to what I said before, D and B12 are easy ones. We could measure, supplement, measure again. Um, I think the rest is a little more difficult. And this is something, I'm really interested in too, as far as, yeah, we always want to know, show us the proof that any intervention is actually making a difference. And there's some different things. So this is less, like hard science, I guess, or quantitative research, but something I just found myself is there's something called the lifestyle medicine health behavior scale. So sometimes we're just using things like that, right? Where it's patient reported outcomes, we call it. And so if it's, specific nutrients like B12 and D, you can look at those numbers. But other things like you started a Mediterranean diet, it may be better to do something like these patient reported outcome validated scales that you can do at the beginning and then, a few months in or something like that. But that's an area I'm really interested in too, because a lot of it, at least for me in my practice so far, it is pretty anecdotal, right? As far as just hearing enough patients say, I've made this change and now I'm, having more energy or, whatever the case may be.
Uh, Thank you. One more question that I'll start with you for, Kara. There's a question specifically following up on vitamin D. Um, how do you think about balancing, sun exposure and the risks that that entail with vitamin D? Is there any recommendation per day for vitamin D or recommended sun exposure dosage, if you will?
Yeah, it's really hard to get the D that we need from sun exposure. And I should have looked this up before coming on today, but there's some statistic of what percentage of your body would need to be exposed for how many minutes, every day to kind of get what you need. And it was a lot, like something I would probably not be comfortable going, outside with that much skin exposed every day, especially in the winter kind of thing. So as far as my practice, I don't really recommend people, your D is low. Now I'm recommending be out in the sun for this amount of time. Number one, I mean, there is that skin cancer, right? Kind of push and pull that we have with dermatology, I guess. But also, I think it's really hard to raise your level, especially just in the industrialized lives that we live now, just through sun exposure.
And I'll add a little bit onto that too. Geographic location influences how much your skin is even able to synthesize. So if you live a certain degree north, during like half of the year, November to I think it's May, even if you were outside in a swimsuit morning to night in the dead of winter, your skin still wouldn't be able to synthesize any vitamin D. So for northern, more populations, it makes it increasingly difficult to be able to keep that vitamin store up because you really only have the summer months to even be synthesizing it.
Yeah, good point.
And looks like one more follow-up question on vitamin D from Krista here. There was mention of vitamin D possibly causing calcium buildup in the body. Do we have a sense of how true that is, even if the vitamins that we're taking do not explicitly contain calcium and it's strict?
So I think I had a little tech glitch there. Are
Oh,
we back?
yes. Can you hear me now?
Oh, yeah. Melanie, do you want to take that one as far as how D and calcium are related?
Yeah, so as I've mentioned before, every nutrient in the body has a relationship with other nutrients. And so even if vitamin D supplementation doesn't include calcium in that supplement itself, vitamin D, its behavior in the body over time increases calcium. So if vitamin D levels get too high, that's also going to drive up calcium, and that's where complications can occur. So it's not that the vitamin D supplementation is inherently bad. We do want to keep it in a good healthy range, but this is where we don't want to indefinitely be supplementing with vitamin D blindly, where we're not getting lab tests done to make sure that vitamin D is at a safe level, and as opposed to trending too high, because when it trends too high, that's when we get at risk of that hypercalcemia.
There's one question here from Sage around how to think about different types of cooking oils. So Melanie, I think you touched on this a little bit, but specifically have heard to avoid coconut oil due to high saturated fats. Do you have a perspective on that?
Oh, that's a good question. Yeah. And I know even with the swank diet, I think is the diet specifically that recommends decreasing saturated fat. So I think this one is, it kind of depends on diet as a whole, right? How many other sources of saturated fat is an individual consuming? And if there's not a lot there, then, if coconut oil is used in moderation, I think it's an okay thing. But if the rest of the diet is also super high in saturated fat, in addition to high levels of coconut oil, then that's where we're at a little bit more risk. So I think this goes back to kind of the concept of moderation and variety. So trying to eat more foods in moderation in favor of trying to get all of the foods in more variety. So eating and including different oils instead of just leaning into only extra virgin oil or extra virgin olive oil or only coconut oil all the time. And even outside of the saturated fat content, just switching up the cooking oils that you're using are going to provide you a specific set of micronutrients and antioxidants that I didn't quite get into, in addition to those omega-3 fatty acids that are present.
And building off of the antioxidant point, there's a question specifically about how helpful mushrooms can be here. And are there any specific types of mushrooms that are more or less effective when it comes to delivering those antioxidants?
That's a great question. And I don't know that I can speak to that down to the individual mushroom to mushroom basis. I know that, I mean, there's a loads of different mushrooms, and I think they've really increased in popularity. And I know outside of necessarily antioxidants, that there are a lot of like purported different benefits, kind of like that adaptogen concept. But I don't know on an antioxidant level off the top of my head, and I apologize. Kara, do you happen to know about that?
I don't. I sure don't.
I was like, is me the dietitian doesn't know? I know.
Well, one question for you here, Kara, and apologies, I'm not familiar with the acronym, but any opinions on NAD and shots?
NAD and shots. I don't know if I should know. I'm feeling maybe like Melanie was just feeling. Should I know what that is? NAD and shots. I don't know what they mean.
I think they're referring to getting infusions. Like getting, how you can go in and get like glutathione and B12.
Oh,
NAD is an add-on that you can get.
oh, okay. So Melanie, you maybe can speak to this better.
Yeah.
You
Yeah.
know what they're talking about.
I can't speak better to it, especially not in the context of autoimmunity and MS. I know that NAD is very popularized for anti-aging and energy levels and a number of other things, but I don't have any knowledge on supporting autoimmunity and its effectiveness.
Oh, NAD plus, apologies. Follow up here from Sabrina. Yeah. Cool. And Kara, one question here also. Does Rocky Mountain today offer any type of nutrition counseling, as far as you're aware?
So we, as of right now, don't have like a dietitian or nutritionist, on staff. But specifically, our nurse practitioners have a high interest in wellness as a whole. And so, more than happy, and we're starting to do more of this as far as at least getting started on the basics for some of this counseling.
Melanie, one question I have. I heard you ran through a ton of content throughout the presentation around tips and tricks and helpful advice here from a nutrition and wellness perspective. I heard you mention that no small tweak is too small. But for someone who's looking at, the list of potential things that you could do to try to really start investing in your own health and wellness, what advice do you have for people who are just looking like where to start, where to begin making that small tweak?
Yeah, so I like to start with where there's motivation and where there's inspiration. So if you feel like movement is something that's really on your mind and you feel like encouraged and motivated to try that, then let's start there. If you want to learn how to cook one new meal, like let's begin with where you do feel a sense of interest and motivation, because that's gonna help things click, and that positive reinforcement is going to keep you coming back, hopefully, and doing that day after day after day. And then from there, that's going to build confidence and help us layer in additional benefits and habits and whatnot. So I know that's probably not the intention behind the question asked, but I don't think there really is like one thing that's more important than the other. I think it's very individualized and kind of like where are you coming from and what are you already doing versus what aren't you already doing, and then kind of picking and choosing and prioritizing from there.
And I heard you
And
mention process. Oh, sorry. Go for it, Kara.
no, I was just going to jump in and say the patient reported outcomes and the scales that I was talking about earlier, those are kind of a nice way to sort of identify that. So in some of those, scales, you answer a whole bunch of questions, and it can kind of highlight like, here's where you're doing really well as far as, lifestyle management, here's what could use some improvement, that kind of thing. So just to add that on, that can be a nice thing if you're not sure where to start. That I think is gaining more traction, that we'll start using more in the clinical setting.
Got one question here from Bruce, I think for you, Kara, if you have a perspective here, but any opinion on the current subject of aluminum and mercury or thimerosal
Mm,
as it relates to preventative vaccines for people with MS?
mm. I can't say that I have too much of an opinion on that. I think back in, I don't know what, the early 2000s, there was some buzz about mercury and people getting fillings in their teeth removed, that kind of thing. I don't think the data ever panned out that was something, we should be advising or concerned about. That's pretty much all I can say on that. I am not up on the latest if that has been looked at specifically in MS either. Oh, I will say overall, as far as in our practice, we do recommend people get their vaccines, because what we do know from data is that the healthier you are in general, the better you'll handle your MS. And so as far as flu vaccine, COVID, in our practice, we are advising that patients get their vaccines.
Well, believe we're at time here. Just a huge thank you to our panelists who took the time out of their day to share some words of advice and guidance with us. So thank you again, Kara and Melanie, for all the time you put in here. Really appreciate it, and thank you to everyone who took the time out to attend this session. Hopefully, you all found it helpful, and we'll save this recording and share it out for folks who want to refer back to it, and also want to encourage people to check out Melanie's website, earth2mel.com,
Thank
to
you.
learn more about all the great work she's doing. And Kara obviously can find her at Rocky Mountain MS Clinic out in Salt Lake. So thank you all for the time.
Thank you so much.
Thank you.